Welcome everyone to today's webinar, The Digital Patient Experience, Empowering True Consumerism to Drive Clinical and Financial Outcomes. I am Brian Zimmerman with Becker's Hospital Review. We'll begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenter, Spencer Cross. Spencer Cross leads the product strategy and development for Change Healthcare's digital experience business. Working with providers and payers, Change Healthcare has developed a unified experience layer to bridge workflow silos and present a single, intelligent experience to patients. Prior to Change Healthcare, Spencer's background is deep in healthcare technology, having developed products at Relay Health McKesson, Epic Systems, and other healthcare entrepreneurial ventures. Spencer received his MBA from Harvard Business School. At this time, I'm pleased to turn the floor over to Spencer to begin today's presentation.
Thanks, Brian. Appreciate that. And again, I'm very excited to be here and talking to you all today about how we can really improve the patient experience in healthcare, taking the best in digital consumer technologies and applying it to traditional patient experience and healthcare scenarios. So today we're going to walk through a few pieces of background to talk about how patient experience has traditionally been approached in healthcare with traditional patient engagement tools like patient portals and the like, and how those are sometimes can be ill-equipped to be able to meet the rising consumer demands of patients today. Then we'll walk through what elements are critical for a true consumer healthcare experience, a true digitally empowered healthcare experience. And then lastly, for the benefit of the audience, walk through what are the questions that you all should be asking to your technology vendors and your service vendors when you're looking to embark on consumer initiatives, digital patient experience initiatives. So to get started today, I think it's important that we anchor ourselves in the fact that the consumerization of healthcare is already here, right? I mean, over the last 10 years or so, the advent of high deductible health plans has grown about 600%. And we find that now that consumers are empowered with the incentive to shop for care, they're treating healthcare like they would any other industry, whether that be retail and their Amazon experience or food and beverage, and likening their interactions with their PCPs, with their interaction with their barista at their Starbucks at the corner, or even thinking about it in terms of an airline experience. I mean, consumers are now comparing those industries that they traditionally are shopping and are empowered within to healthcare now that they're given that incentive. And we're increasingly seeing the regulatory burden placed on providers, especially, to enable this consumerism in healthcare, to bring technologies, processes, and people that can really elevate this experience. And so it's important that we as providers and technology vendors that support providers are able to really tap into what is it that consumers want when it comes to healthcare and their healthcare experiences. So to just emphasize that one more time, the consumerization of healthcare is here. We are not, we're no longer saying that by 2019 the consumerization of healthcare is here. The consumerization of healthcare is here today, and those providers that are not equipping themselves with processes and technologies that address that consumerization are at risk of losing patients to those providers that do, because patients will gravitate to the place that it is easiest to receive care. And so it's important that we think about what are the ways that we can really make that experience the best possible experience it can be for our patients. And some examples of that and some trends that I want to highlight here on the call today are on this screen. So I mentioned a bit about how healthcare spending has increasingly gravitated towards patient liability, patient responsibility for that. So you can see that about 30% of U.S. healthcare spend is now driven by the actual patient out-of-pocket amounts. And that's primarily driven from a variety of factors, but we oftentimes see that, especially for patients that are within high deductible plans, that they are, that burden is increasingly shifting to them. More so, and I think another factor that leads to this is that increasingly decisions are being made by millennials and kind of younger demographics, and now we're seeing that more than half of all healthcare decisions, whether it be by millennials for their own care, millennials for their children, millennials for their elderly parents, are driving behaviors. And so, those increasingly mobile-friendly populations, mobile-friendly audiences are those that are driving those decisions, and they're used to going out to consumer review sites like Yelp, Google reviews, and et cetera, to make decisions for their other consumer purchases. And so they're expecting that, and they are performing those kinds of searches in healthcare today. So it's important that we tap into that existing workflow that those demographics prefer. And then I think just lastly, the thing that I'll mention on here is that, especially over the last month, it's become increasingly relevant that regulators, both at a federal level and at the state level, have their eye on consumerization, have their eye on the patient experience of care. For the last decade, we've been primarily focused, when you talk about technology in healthcare, on the B2B side, how providers interact with technologies, how revenue cycle technologies efficiencies can be taken out of technologies. And now I think we're seeing that regulators are wondering, okay, well, why hasn't that impacted the patient experience? Why is it that digital scheduling is still lagging far behind? Why is it that price transparency is lagging far behind in the industry? And it's important that our providers recognize that if they are not responding to these trends themselves, the decision will be made for them by regulators to implement these technologies and these processes. So then, in responding to these trends, I think that there's a few pitfalls that we see providers typically fall into. So frequently when I'm on site with customers and I'm giving these kinds of presentations, providers will tell me that the patient portal is their center for patient engagement. It's where they would like to drive all patients to pay their bills, to do scheduling, to communicate with their providers. And what's important to realize, there is and will always be a place for a patient portal. But what's really important to recognize is that within 2018, only about 28% of U.S. patients logged into the patient portal once within the calendar year 2018. And so if you are relying on the patient portal to be your source of consumer engagement and tucking everything within that patient portal, you're going to miss out on the vast majority of your patient population to deliver engaging solutions, engaging communications, and elevated experience to. So it's important that you look beyond the patient portal to what's referred to as omni-channel approach of, yes, patient portal is one channel, but email, text message, publicly available websites, direct mail, call center, app-based push, voice, Alexa, Google Home, etc. All of those are tools that your patients want to engage with, but that the patient portal is not very well equipped to be able to reach out across. The other thing that I think is really important is that it's important to recognize that it's not technology that's disrupting healthcare. technology very rarely is the disruptor. The consumer is the disruptor in healthcare. And consumers are increasingly pushing us to have mobile-friendly experiences. And what you find is that about 81% of U.S. healthcare consumers have smartphones and want to use those smartphones to engage with their healthcare providers. And so it's important that the technologies that we enable our consumers to use have mobile responsive frameworks, that whether they be an app, a native app on a phone, or a web presence that is mobile responsive, it's critical that every single touch point that we have with the patient is also accessible through the smartphone. And part of the reason that that's being driven, and I think something that providers frequently overlook, is that the increasing percentage of our audience that is millennial is not tied to an individual provider. You find that millennials do not have loyalty to one PCP for the duration of their lives. They will go out, even when they receive a referral from a provider that they trust, 33% of the time, and go and search for either better pricing, better reviews, more convenient applications, and that kind of behavior requires that U.S. healthcare providers respond in kind to that behavior. So to really summarize that, and what can you do as a provider to enable that experience? Well, one, it's important that, yes, we have portals to access records and various pieces of functionality and services, but having an assortment of portals where a patient might need to go to one portal to schedule a visit, another portal to pay for that visit, another portal to look up their referrals and message with their provider. That experience and needing to manage passwords and workflows and remember how to interact with those is just something that's not sustainable in healthcare. You wouldn't expect that when you go to Starbucks that you would shop for your coffee in one portal, order the coffee in another portal, and then pay for that coffee in another portal. But somehow in healthcare we have arrived at a situation where that's the norm. And we need to make sure that to elevate the experience in healthcare, that we move away from that siloed experience to a single experience powered by a single experience layer. Secondly, and as I mentioned before, all of those experiences, all of those digital touch points with the patient, whether it be a text message or a content on a website, an email, telehealth visit, have those be mobile optimized so that we're able to reach patients just directly within their pockets the way that they want to be interacted with. And then just lastly, I think, and this is something that we see more and more, is this move to a philosophy of taking your interactions and having them be what's known as digital first, where, yes, a patient access call center is important for receiving phone calls for the purpose of scheduling. Having care managers go out and interact with patients, that is very important, and you cannot replace the person-to-person interaction. But it's important from a cost reduction perspective as well as a reach perspective to think about how those services, those traditionally labor-intensive, person-intensive services, can be oriented to a digital-first approach where maybe the first touch with the patient is online, is a text message, is an email, is a link to a portal. But then that next interaction can be over the phone, can be in person. If that first digital interaction either doesn't drive the behavior that you would want, or can maybe equip the patient with information that they wouldn't have had such that they are prepared for that in-person interaction when the time comes. And we see that very frequently when it comes to moves to price transparency, that can we alert patients to their upcoming responsibility prior to them setting up a payment plan with a financial counselor, prior to the time that they come in for that service or procedure. And so that brings us to the second learning objective today, which is what are those cornerstones of a true consumer healthcare experience? So one, and I think this is very important to keep in mind, is that any experience, any consumer experience must be built off of the existing core competencies of your organization. You can't go out and acquire a digital scheduling vendor and expect that it will be a panacea to solve all of your scheduling needs. You can't expect that a single price transparency solution will solve all of your prepayment needs. They need to be in context of the existing workflows and technology stacks that your organization has, and be able to pass data freely back and forth between those systems, such that when the patient moves from the consideration stage of shopping for care to the decision to book, that the experience can be consistent as they move from stage to stage. Second is that, and this is, I think, good news, is that we have such a wealth of examples to draw from other industries, such that, a lot of that, the check-in experience has been solved already in the airline industry. The booking experience has been solved in the hotel industry. The retail experience has been solved by e-retailers like Amazon or Shopify or eBay. And now, as healthcare typically runs 10 to 20 years behind other industries, we can borrow successes, borrow insights from those other consumer-facing industries and apply them to healthcare. So an example here would be shopping cart workflows. I do a lot of online shopping, and when I load something into my shopping cart, I oftentimes receive an email, maybe later that day or maybe the next day, if I didn't purchase that item, with either a discount or a reminder that, hey, maybe I actually wanted that shirt that's in my shopping cart. We can think about that and apply that to price transparency, where very similar, you're shopping for care, looking for the best provider, the best price for your upcoming MRI or your hip replacement, and maybe the patient doesn't book at that time. How can you take that behavioral insight of the act of shopping and then turn that into an engagement campaign that brings the patient back, establishes loyalty, and promotes the behaviors that drive value back to you as an organization? And then lastly, it's critical across all of these in any experience, whether it be access, whether it be clinical or financial, that the data layer is consistent, that the patient data that is powering these experiences, the healthcare data that's powering these experiences, is the same layer, such that no matter if you are interacting with a clinical piece of technology in one department, and if you move from oncology to radiology, that data layer is the same. That when you move from clinical to financial, that the financial systems know that you have upcoming referral orders, that you have upcoming lab tests that need to be performed, such that when they receive a communication about a bill, it's in context that, hey, you're likely to receive another bill 2 weeks later for X procedure. We might not know what the total of that is, but we do know that you should be expecting that. And that's the kind of level of service that patients expect from other industries that we need to start applying here in healthcare. And I think this brings me to a broader point about how we think about healthcare and borrowing technologies from other industries. So when we look at other industries, and we have a few examples pulled out here, we see an ability to unlock value out of basic functionality, out of basic tools, whether that be what Venmo has done for online funds transfers, or what's not mentioned here, Uber has done for the taxi industry. The taxis have been around for 100 years, more than 100 years, but what the revolution has happened is when the simple concept of moving from point A to point B and paying for transportation between those, the revolution occurred when you actually put that within a streamlined journey. You add context. You look to how the consumer wants to interact with that experience. So I want to know where my cab is. I want to be able to call it on demand. I want to know the quality of the driver, the quality of that experience that I'm going to have before I get into the car. I want to be able to track where I'm going. I want to be able to pay for that automatically so I don't have to do that awkward dance where I'm pulling out my wallet right just when I want to leave and get into the restaurant I'm trying to get to. And so we need to be thinking about that in the same way, that frequently healthcare organizations buy digital point solutions and expect them to be this streamlined journey, to expect them to be this utopian solution to the overall experience. And what's critical here is that the point solution is just that. It is just a point solution. It is a piece of functionality. But what unlocks the value of that is when you put that in the context of a broader journey. So I'm going to walk through what that might look like here on this next slide, where, yes, each one of those light blue boxes might be an individual point solution. But where is the connective tissue? Where is the communication, the next best action suggestion that drives a patient to those individual point solutions? Well, that's got to be that continuous data layer, where we are moving moving the patient as they drive us from appointment scheduling to education to a service for financial counseling to the actual arrival procedures and check-in procedures, such that the patient doesn't need to log in and out of different portals. They don't have to remember that they have an appointment in 3 weeks and never receive a notification about that. That through line is that digital patient experience, that digital patient orchestration engine that moves with the patient, anticipates their demand, and can coordinate those services along the journey here from point to point. And I think what's critical just to call out is that it doesn't ultimately matter what those light blue point solutions might be here along this journey. What's critical is that through line is able to anticipate the demand of the patient and be designed by the healthcare institution to drive the behaviors that they want to drive. And so this brings us to what we're doing here at Change Healthcare to solve for this experience. And so we've segmented that patient journey into 4 different buckets. So starting on that left-hand side, finding care and access, which would be from that first visit to Dr. Google that the patient makes, where they're experiencing symptoms and they're trying to research what they should do about that slight pain that they have in their back, all the way through the actual scheduling experience. How can we ensure that the patient is passed from that anonymous click traffic where we may not even know who they are, and continue to make that experience personalized all the way through the point of scheduling and arrival into the clinic? Second is financial care, which is coordinating the revenue cycle experience of the patient, ensuring that the statements, the charges, the billing experience feels consistent, feels intelligent from the perspective of the patient. It may be chaos underneath the covers, but from the patient's point of view, it should feel like a single experience, a single intelligent workflow that they're being asked to perform. And the reason that we have this second is it's it's really a key focus of ours to accelerate that revenue cycle as much as possible. So start the revenue cycle at price transparency. Start soliciting for prepayment and maybe giving patients incentives in the form of discounts or other incentives to be able to actually prepay for those visits, and then enable them to schedule within that exact experience so that it actually brings all of those elements that a patient would want ahead of the procedure into that one continuous flow. Third is the connected care experience, which is the experience of the clinical experience of care from the point of view of the patient, and managing follow-up for patients as they move from provider to provider, or anticipate needs for education or other clinically relevant pieces of information that they might need along the way. And then lastly, for patients that are outside of an active care episode, how do we keep them engaged as patients? How do we retain those 33% of millennials that are liable to move from site to site? And so there's a variety of interventions that we found that can be helpful there, whether they be preventative care reminders, loyalty programs, but even as simple as feedback surveys that enable institutions to be able to improve on operations while they're managing their social media presence on consumer review sites. And ultimately, what we found is that providers are able to increase revenue in the form of either new patient acquisition or the monetization of existing patients through driving behaviors that add value to providers. Reducing cost by moving some of those interactions to be digital first. And then lastly, elevating the reputation both online and with patients in person through improved patient experiences. And as Change Healthcare, we can't do this alone. We've to take our own advice, have partnered with leaders in consumer experience to empower them with the workflow solutions that we have as Change Healthcare, with the data that we can pull from providers as Change Healthcare, and then leverage best-in-class marketing automation technologies that are provided by Adobe and best-in-class cloud service and CRM technologies that are powered by Microsoft to really bring this experience together. And what's great about partnering with consumer technology leaders is that they are the ones that are designing those airline experiences, those hotel experiences, those retail experiences that have revolutionized other industries. And we're able to borrow those leaders, borrow those insights, and apply them to healthcare really for the first time. And so we're very excited to be partnered with those leaders and be bringing those technologies into healthcare. So how this looks, at least from a Change Healthcare perspective, is that we connect to those data sources wherever they might live, whether they be an EMR, whether they be a CRM, whether they be a billing system, a patient access system, what have you. The core competencies, the core workflow technologies remain the same, but what's differentiated and what's really moves the needle for patients is creating that consumer data layer, beginning with data services that massage that data as it comes in from those various either healthcare sources or consumer data sources like market data, personal health record like wearable data, or other consumer sources, and bringing those together into that common data layer, applying different layers of analytics, whether those be things like propensity to pay scores or population health risk scores, or even just contact center management, such that by the time that we actually want to go ahead and orchestrate a patient journey, for instance, escorting a patient through a knee replacement journey, that all of that data is available, and we can anticipate that when we receive a referral order, we can trigger an outreach. When we receive a scheduling event, we can send a text message. When we anticipate that patients will want education, we can intervene with a mailer or a phone call. All of that is done through that orchestration layer and then managed through an enterprise content management system to keep that, those, whatever touch points you have with the patient, make sure that the content is consistent, whether it be on a mobile phone, an email, call center, and then manage branding. Because
Are you
frequently,
on the webinar question mark?
Frequently, they have a frequently we have multiple brands that need to be managed, that being able to dynamically switch those out as patients move from brand to brand or organization to organization, ensure that those experiences are consistent. All right, so then I think to move it from kind of theory into practice, we have a couple examples here that we found to be particularly successful. So we'll start with one that's in the financial space, and then we'll move to one that's kind of more clinical. So we start with this experience that we've dubbed Shop, Book, Pay, which is taking those individual point solutions that frequently are individual technologies that patients need to seek out for price transparency, for digital scheduling, and for online bill pay or payment plan creation, and move them into a single experience that escorts the patient from step to step. That taking those individual point solutions, adding context to them through patient data, through additional layers of functionality and service, and then driving outcomes that lead to benefits that providers want, whether those be driving patient volume, increasing quality of care, driving patients to prepay and collect. And so what we've designed is this experience that really drives from shopping to booking to payment, where that you can see on that left-hand side that shop experience for care is designed to be very retail focused, to have pricing that is contextual with the patient's actual out-of-pocket liability as determined by their specific plan information, allow them to have inline ratings and reviews for certain sites with quality ratings or consumer review ratings, and then allow them to drill down and learn more about either whether they be a particular provider or a particular facility, and then actually schedule that visit through a digital scheduling experience and pay for that experience through an online payment portal or technology solution. What we find in here, and I think what's really cool, is that we find that patients are 6 times more likely to shop for care when prompted to do so. So we oftentimes make this experience available to patients as general consumer site, whether you see here on a phone, through a mobile responsive browser, or on the web. But we also trigger this experience through care reminders, whether those be through a preventative care setting, reminding patients in this case about a mammogram, or through receiving referral orders that come from our provider customers, scheduling events, or other situations that we can anticipate that a patient may want to shop for care. We can trigger this experience, send a patient a reminder to actually engage in this shopping behavior. And so we find that when we pull all of these steps within one single experience, you're able to drive far more bookings because it's contextual with that pricing information, and then drive far more prepayment because it's just all within that one experience. To complete the experience, you finish with payment just like you would on Amazon, just like you would at a hotel. So then I'll flip us and also talk about the connected care experience. So in this case, this is an experience that we've created for diagnostic procedures. In this case, I think this is a radiology example, where we require follow-up recommendations by radiologists and turn those into engagement campaigns that go out to the referrers to alert them to the need for follow-up, as well as patients to make them aware of the need for follow-up and drive action, whether that be for scheduling, prepayment, educational materials, or a phone call. This experience has been specifically designed to address the need in healthcare of incidental findings, where frequently, and you can see there, about 2/3 of incidental findings that would be recommended for follow-up ultimately don't receive follow-up. Because either the incidental finding is tucked at the bottom of the radiology report and the referrer doesn't notice it, or maybe the referrer may notice it and the patient doesn't end up following up, or they never communicate to the patient about the need for follow-up. And so what we do, especially for our diagnostic radiology providers, is to alert their referring population, alert their patient population about that need for follow-up, and then provide them the tools to do so. And so what this looks like in practice is this experience where the incidental finding is discovered. We start by notifying the referrer and seeking acknowledgement, providing them with context on details about the exam and the procedure and what the actual follow-up recommendation might be given industry-accepted clinical guidelines. And then drive acknowledgement, drive action, whether that be the placement of that follow-up order or an indication that a patient is ineligible for follow-up. We ask our referrers to be able to do that. This is especially helpful, and what you see here is an experience that's powered by actually email, because especially for independent radiology groups, they don't have the ability to have an inline alert within the EMR that might alert the referrer to this behavior. They don't have the ability to go through a traditional EMR pathway to make this known. So email is a preferred channel to make this alert and to drive this action. If the referrer either doesn't respond, or if they do respond and indicate the need for follow-up, we will outreach to the patient, doing our best to not alarm the patient for their follow-up need, but then trying to drive to action, whether that action is scheduling or that action might be a phone call with their provider, but trying to drive patients to whatever is the next appropriate action. And then what you see there in that third screenshot with those cartoon images is the actual scheduling experience that we will route patients to. And we find that they're far more likely to actually schedule care when they are in fact prompted to do so. And then, of course, every single touch point, whether it be with a referrer, whether it be with a patient, whether it be online traffic, is tracked and then made reportable to our provider partners, such that they're able to ensure that patients are not falling through the cracks, ensure that referrers aren't being over-spammed with notifications, that engagement on this workflow is high, and then ultimately drive more business back to their practice in the form of more follow-up exams, better quality of care, reduce cost of needing to manage this in a manual capacity. And so these are just a couple examples about how we think about orchestrating these journeys for patients, whether it be in a revenue cycle capacity or be in a clinical capacity. But what should be clear here is that we're driving patients from step to step, from point solution to point solution, such that we are ensuring for that elevated experience. So then, just lastly, to bring this all together, what's critical for providers when they're looking at other patient experience vendors is to ensure that they are delivering that orchestrated experience across journeys, whether it be a financial journey or a clinical journey, and recognize that technology is not the core solution that is disrupting the behavior here. It's not a digital scheduling solution that's going to solve scheduling woes. It is the consumer and matching them where they are and anticipating their needs that is going to really move the needle. And so being able to build on successful consumer experiences, creating experiences more so than just B2B experiences for revenue cycle professionals or clinical professionals is critical. Second, is that the ability to aggregate data across multiple data sources is absolutely critical so that you're able to personalize every touch point and predict next actions as patients need them. Third is to move from simply best-of-breed consumer experiences to a technology platform that can coordinate across those. That there might be excellent consumer experiences out there, and that's great if they're managing the experience well and driving behaviors that add value. But what can unlock value even further is when they're tied together with a single platform to inform and personalize those interactions. And then lastly, and this is, I think, very clear, is that it has to fit within the existing constraints of your IT and business teams. So I think when we talk about technology platforms, frequently that can cause anxiety on the part of our provider customers and others in the healthcare industry. And I think having a vendor that views this as more of a partnership and less of a plug and play and walk away kind of technology arrangement is very important. Something that can be scalable without needing constant IT involvement, interfaces, and maintenance is very important. So with that, I'll open ourselves up to questions here. I'll turn it over to Brian and see if there's anything, what questions that you all have that I can answer about elevating the digital patient experience.
Thank you, Spencer, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard, and we'll try to get through as many as we can. We've had a bunch of great questions come in already, and the first one we're going to go with is, do you think that patients don't use the portal because they don't want to, or organizations aren't doing a great job communicating and pushing the portal and sharing the uses and benefits?
So I think it's all of the above, and I always think analogies are helpful for these types of questions. So if you think about what are the things that motivate you to download an app on your phone, right? I don't know if any of you are like me, but I view that app real estate as being sacred, right? I only have so much space and so much attention to be able to devote to an application. And so what really motivates me to use an app and to download an app is when I use it more frequently than once a month, when it has multiple pieces of functionality that enable me to do a variety of activities, when it's not obtrusive in over spamming me with notifications. And I think about patient portals in the same way, that patients, yes, they may have a need where they log in. They might need to log in once a year, right? If they don't have chronic health conditions that they need to manage, or family members that they're giving care to. So in those types of situations, if you're only logging in once a year, how much value is there on a portal? What's the incentive for you to even remember that a portal exists? In that case, I think trying to reach patients through other methods, so email, text message, and then route them to the portal for those services that can really only be delivered through an authenticated experience is really critical. But then also, and I think the questioner referenced this, is that I think providers also don't always do a great job of communicating the value that can be delivered from a portal, or even enabling those features from within a portal. I mean, frequently you look at patient portals, and frequently they are meaningful use driven solutions, right? And they're oftentimes developed by software vendors, EMRs, revenue cycle systems that are used to developing B2B software. So if you look at, and if I look at my providers, my personal providers portal, it reads very much like a B2B technology solution. Where that's great for me because I'm used to B2B software, but for my mother and for my grandmother, they want that experience to be more like their iPhone or be more like another consumer application. And so I think there's also just a challenge on usability in patient portals that they're not always designed with the consumer experience in mind. They're designed with the provider experience or the provider functionality in mind instead.
Thank you, Spencer. Some sound insights there. And the next question we'll roll with is, how does the approach of digital experience change for rural or lower income areas?
Yeah, that's a really great question. And so I think one thing and one myth that persists in the industry is that rural populations and low-income populations don't use smartphones or don't use them at high rates. And in fact, that's frequently and increasingly not true, that increasingly lower income populations and rural populations do use mobile technologies, are increasing in access to LTE, 4G capabilities in rural areas, or technologies for low income populations in urban areas. Now, that being said, they do interact at a lower frequency than what you might imagine for a more affluent or urbanized population. And in that case, I think it's important that the omni-channel be adjusted for those populations, that it's not a one-size-fits-all solution that all communications should occur via email and text message, that there are segments, maybe by zip code, by financial information that you might have with the patient, that you could tailor the method that you communicate, even though maybe it's delivered in a mailer and not via an email, but the content is the same. And attempting through whether it be A/B tests or retargeting to find the communication channel that works for those populations. And so just to kind of pull out one more example out of that is that we've run a lot of tests in a variety of markets and found that there's this large difference in the usability of emails, whether they are received before and after work, when people are checking their personal emails versus during normal business hours. And so you might find that through iteration, through testing, that even for those population segments that are you would expect to be lower in their engagement, that through more testing, you can figure out that maybe another channel is more appropriate, or if you just send it at a different time or different language in those messages, such that you're able to increase engagement.
Excellent. Thank you, Spencer. And so the next question I have here, the attendee asks, prefaces the question with, you may have already addressed this, but are your clients capturing improved clinical follow-up adherence and, I presume, improved long-term clinical or quality outcomes that come with that compliance?
Yeah, and I assume that this is in reference to the incidental findings follow-up solution. And so,
I believe so,
yes,
yeah.
Yeah, so I would say yes, that and this is to be fair, we are this is a new solution for us. So we've been out in the market for just a few months now, operating this really at scale. And so I'd say that yes, our early returns are showing that one, that referrers are engaging with these, meaning that they they are receiving value from this level of communication, and two, that they are putting in orders, follow-up orders at rates that you would that show that we're driving value back to these practices. I would say that from given that some of these incidental findings can, the earliest follow-up can be 3 months, or 2 to 3 months out into the future, all the way out to 24 months out into the future, or even longer, that it'll still be a while before we can really have publishable data on this front. But I would say that early returns are showing that this is driving more visits back to our radiology partners, and elevating the level of elevating the quality of care that those radiology groups are able to deliver.
Excellent. And we'll move to our next question here. So what is your advice to healthcare organizations that struggle with integrating their data currently, and what are interim steps they can take to move toward a fully digital strategy?
Yeah, no, that's a great question, and that's a $1 million question, is how do you integrate across all of those different technology stacks, right? And I'm not going to stand here and tell you that it's going to be easy. And frequently, this is where a lot of healthcare systems throw up their hands and give up, or even technology vendors end up going bankrupt trying to solve this problem. What I would say as an advice is to look at, rather than looking at it as a technology challenge, look at it more so as what are the elements that are required to drive the consumer behavior that you want? So rather than looking, all right, we need to integrate to this scheduling system and get all the scheduling data, and I need to integrate with this ordering system and get this order data, and this price transparency system and get that information. But more so think about, all right, if I want to empower a patient as they move along a hip replacement, well, what are the things that I need? I need the trigger for that referral order. I might need some scheduling information for my orthopedist. I might need some price transparency data for that certain set of procedures. And that's the way that I would go about it. In the absence of enterprise data warehouse or any sort of other platform technologies, is to really distill the problem from being a behemoth entire journey, every single possible permutation of what you might want, down to just what specific journey do I want to empower, and what are the most important data elements that I have along that. And I think at least what we found is that when you frame it in that way, that even from like a MVP, a minimum viable product solution perspective, you can pull out even like man behind the curtain kind of workflows where you're pulling data manually and just showing that this is possible as you build out those additional integrations and identify the elements that are required.
Thank you, Spencer. And got a couple more questions here we can get to. So this next one is, how do you integrate all the different data sources you listed, Salesforce, Epic, etc.? Is this done with Salesforce or some other tool?
Yeah, so what we use is we use our Intelligent Healthcare platform, which is a technology platform within Change Healthcare to bring those elements together. So, and that has a variety of data services that are a part of it. So those would be things like managing patient identity across multiple systems, and that can be increasingly challenging when you look at something like an ACO, where you might have two different, not even just two, you could have 12 different EMRs that you need to be able to manage identity across. So we have sophisticated identity management algorithms to try to match patients together. We also have curation so that we can dedupe data across multiple systems, and then a variety of other services that really pull that record together so that by the time that you're done massaging the data, you have a pretty good sense that Spencer has seen Dr. Jones, Dr. Sally, Dr. so on and so forth down the line, and these are the medications that he has, this is the referral orders that he has, and then that's what we use to empower the experiences. So we leverage a lot of that technology that we have internally to really make this experience possible.
Great. And so the next question we have here, the attendee wonders, is the product modular? Incidental findings, for example, I believe incidental findings module, what they're referring to?
Yeah, absolutely. And that's another thing that's critical, is that I think frequently providers fall into the trap of trying to do too much at one time. So we've built this solution to be we built our solution at least to be entirely modular, where scheduling can be one component that gets pulled out, incidental findings management can be pulled out, and what's really nice about it, especially when you take that modular approach, is that every additional use case that you bring onto the platform becomes smarter because it's more data in the platform. It becomes more valuable because you're coordinating more activities through that, and then you're also receiving more response data. So frequently we see customers that would start with just one area, incidental findings, price transparency, et cetera, and then add on adjacencies as they go, right? Incidental findings leads really nicely into digital scheduling. Incidental findings leads really nicely into some of the order verification technologies that we're working on for PAMA and in other regulations. It builds really nicely into price transparency down the line. So that's a very regular request that we see, and we've built the platform to be modular as a result.
Great, and it looks like we have time for one last question, and we'll roll with this one. What do you mean by an orchestrated journey?
Sure. This is great because I think it really brings us home on what's critical here, is that as the patients move from step to step on their healthcare journey, it's critical that we are able to meet their demand as they move, meaning that the experience, whether it be with a scheduler, with a clinician, with a biller, or with whomever it might be, every touch point within that journey is deliberately designed such that the provider is able to escort the patient from step to step, elevating the experience on the part of the patient, which has reputational benefits, has acquisition benefits, but then driving behavior that providers value. So driving for prepayment, driving to schedule clinical follow-up, driving for preventative care needs. All of those can really only be done once you have that overall view of the patient and be able to orchestrate that. An email is sent 2 days after a referral order, a text message is followed up 2 days after an appointment, digital tools on a website are personalized at 3 days out. Whatever those scenarios might be, the only way that we're able to really orchestrate those together is by having that common data layer, and then being able to pull and track insights across that so that we ensure that the program is being as engaging as possible. Great.
And we're just about at time. Spencer, do you have any final thoughts you'd like to share with our attendees today?
Well, I've said it twice now, but I will say it one more time, is that the consumerization of healthcare is here. We cannot wait anymore on implementing solutions, processes, technologies to address that need. And we are more than happy to share more about what it is that we're doing if folks want to reach out to us directly and provide some of those consumer insights. But yeah, the time is now, both from a regulatory perspective, but then also just to meet the demands of the consumer.
Great. Solid final note there. And thank you, Spencer, for your fantastic presentation, and Change Healthcare for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.